Good day, everybody. Welcome to Dental Voice Season 2 with Zyris. My name is Rolando Mia, and today I think we have Dr. Areezo Bahar. Are you smiling? First of
I
all,
am. This is the alien me, the COVID Areezo.
we
So
met
hi,
Dr.
Rolando.
we met Dr. Bahar almost 4.5 months ago at the beginning of this entire COVID process. And she shared with us some of the things that she was thinking about. She shared with us some of the stuff that she wanted to do and what she was trying to understand. And now, 4 or 5 months later, we're following up with Dr. Bahar to see what's going on, what's real, what's not, and also how things are going. So thank you for joining us. And oh my goodness, so what are you wearing? Well, that's all your PPE, is that correct?
Yeah, that is uh, what we're wearing these days, since COVID, since we came back. So I'm going to take them off one at a time so you can see. But I have a face shield on, and that has a hole for the loop, for my loop to go through. So that comes off. And then, I have my surgical loop. And then underneath this, I take that off. I wear a surgical level 1 mask over my KN95 mask. We change this for every patient. So I don't go into I go to a patient with a new surgical level 1 mask and with a clean new shield for every patient. That gets changed. And then I wear this, which is for the barbers, the hairdressers, they use this and I put a new one of these for each patient. And then that comes off. And then I have my lab coat that gets changed at the end of, depending on what each patient procedure is, and that gets changed. And then we wear scrubs underneath. So that's basically me. And then since I'm in my office, I can take my mask off and I can breathe, and I can take my hoodie off and I can fix my hair. And I need lipstick now, but now I'm kidding.
Oh my goodness. Thank you. Thank you for that. We've heard so much about PPE, but on our show we haven't really seen it. What's your experience? How does that feel? Are you comfortable? Are you acclimating to it? How is it feeling for you right now?
It was definitely an adjustment, and definitely breathing is difficult when you have two masks on. But when we walk into the practice, to the exam room, the operatories, the patients actually, they kind of like to see us, taking all these precautions. It's really front and center that I'm a different person than I was, post COVID. Post COVID, we would have the mask and the shield and the eye goggles and our lab jackets. But, um, you know, 6 months ago, I may have gone in with nice street clothes and my high heels and, like, kind of totally a different look. But now I'm always in scrubs and always in lab coats, and the patients can see that we've made that extra effort.
And how is the rest of your team acclimating to all that extra PPE and all the things that have to happen there?
Yeah, they really were on board right away, and it's hard for them too, but they they wear the same head caps. They wear use the face shield masks. They wear either surgical level 3 mask or the KN95 with a surgical level 1 mask. So they've done tremendously well. I'm really proud of them. They have really stepped up and really done a great job.
That is awesome. We've heard a lot from practices across the country where the team has actually felt uncomfortable and struggled with coming back into the office to the point where some of the team have actually decided not to. How is that with your practice?
We were really fortunate. Every single team member came back. Every single team member has come back. Our hygiene department has come back. Our assistants, obviously all the doctors, our front desk. but we implemented so many other things into the office. We put in iWave technology into our HVAC air ducts. We had 5 of them. We put in surgical clean air units for every operatory, and they are really like the one of the best, I think, air purifiers. Um, and of course, we got our isolites, and I can't live without that. So that
Oh,
that has been really a game changer too. So they feel
so
comfortable.
so before, when we last talked, 4 or 5 months ago, you had never used the isolite, have you?
No, I had never used the isolite. I was told many times, how wonderful it was, and I came close to ordering it, and then kind of didn't. And then I think in February I had met you in the midwinter meeting in Chicago.
Yeah,
And
Dr. Bilas introduced us.
yes, and then that was and he had been telling me to use it and how wonderful it was, and I'm not a good listener. So, but this COVID thing made me really do it, and I really love it. I mean, when I got it, the first case I used it on was a cramp rep on number 15, and a long-term patient of mine who was a little nervous about. I just is always generally nervous about dentistry, but I thought, well, let me try it, and he did tremendously well with it, and it was just really great to be able to have cheek retraction to protect his airway, and also to have the suction, so that it would help with any aerosols. So all in all, and I've used it over and over again. Every day I use it multiple times.
Oh, that's so cool. So you originally got it because of the aerosols, this issue of aerosols. Are you seeing that that's being eliminated, or that's decreasing, or what's your experience with it, and with regard to that and the spray and splatter, all that type of thing?
I think it's definitely, I mean, you can just see you're not struggling with, keeping your mirror always, like defogging your mirror, and you're cleaning it, and just the whole environment looks, I'd see a lot less splatter than I do um, when I don't have the isolating. I have a lot more control of the environment, the oral environment that I'm working in.
That's so cool. Thank you for that. So, how do you feel? Are you personally feeling, when we first talked, there was definitely apprehension about, oh, goodness gracious, are we going to get infected here? This is so virulent. There's so much information. How are you personally feeling about, the potential? You've been now open for several months, and, it sounds like things are going well, but how do you feel about that?
Yeah, things, you're absolutely right. When this happened like March 17th, when we were out and about, and then I had family over. It was St. Patrick's Day, and then we came in, and within a week we had our office to basically shut down. And I remember coming in like a week later to see an emergency patient, and he was a physician, and had been a patient of mine for 20 years. And I was almost hyperventilating treating him because I was so nervous about COVID. And he turned around to me and he said, Areezo, what's going on? And I said, look, I'm just so worried about this COVID thing. And here he is, a physician, delivering babies and stuff. But then we shut down for 2 months. And then when we came back, we had implemented everything. And touch wood, none of our patients are sick. I'm not sick. My staff, my assistant is hygiene. And I think it just shows that if you implement all these precautions, then we can we feel a lot more secure in treating our patients.
That is so cool. Thank you for that. I I have heard that hygiene was one of the areas that clinicians were feeling the most angst. Did you experience that, or do you feel that your hygiene team was feeling that?
Sorry. Can you get Dr. D to do that? I'm in a live webinar. Sorry there. I
No,
did
no, no, not at all.
have
Not at
a
all. Thank
hygiene
you.
check. I can see if one of our other doctors could do the hygiene check for me. Um, yeah, the hygienists were at first really, really worried uh, and concerned, and rightly so, because all the media was focusing as
Oh yeah.
dentistry being yeah, like don't go to the dentist, go to the hygiene, that's going to be like COVID central kind of thing. That was what but they once we had lots of meetings between the in the community, with the dental community, ADA, CDC. We tried to really listen to their guidelines and their recommendations, and then share that with our hygiene department. And then we said to them, these are things we're implementing. How do you feel? Are you comfortable returning to work? And then we didn't go to the old schedule right away. We gave them longer time, so that they could get used to wearing their PPE, what it took to transition. And gradually they got more and more comfortable. And as the weeks went by, they were like, okay, if we do all of this, and we screen our patients, obviously, that's another element of this. We don't just, we have a questionnaire, we take their temperature. And I think patients are also conscious. If they have symptoms or they have any thought that they might be infectious, they're considerate and they don't just come into the office. So I think so far it has worked. So.
That's so cool, and it's nice to see that with the communications. You'd mentioned when we last talked that during the course of this, you reached out and you were talking to the community. Do you continue to do that, and how helpful or how has that been?
Yeah, we really we continue to do that. We really had so many meetings. I was on Zoom meetings like everybody else. I more on Zoom and phone calls and meeting with everybody in April, May, June, July. And then I think we really got into a rhythm back again in July. And people kind of started taking August off and taking a breather. And now we're back in September. Yeah, but now we're back into like meeting with the with the Seattle Study Club members, with the Spear Study Club members, and with the Annapolis Study Club members. We really are reconnecting again and doing what we're doing with you. We're going to meet back as a group and say, how are we doing? How are we connecting? Is everything okay? Can I just put you on hold for 1 second?
Sure.
I don't know how you can pause that.
Oh, that's fine. This is so awesome. Our clinicians join us and they're working, and I love the fact that they're willing to do that, and really appreciate it. Very grateful for that. So Dr. Areezo is awesome. Her alien self. That is so cool. Oh, my goodness.
Sorry, that's live.
No.
Can you hear me?
Yes, I can.
Okay. I'm so sorry I had to do that, but they were.
Oh, you're only working, and you're taking your time to spend with us, and we so appreciate it, and love the fact that you're willing to do this. But so, I was going to ask. You mentioned earlier on that you're loving our system, and we appreciated that. Did you also put it in hygiene?
Oh, we put in every single operatory. We have 8 operatories, so we got 5 isolites and we got 3 isowax. So,
and how has hygiene been with regard to using it? Any issues there?
They like it. I think they also have the leaf, but they really like the isolite. I try to encourage them to use it more and more, but I think they definitely at the beginning we were not using Cavitron, until we got our isolite. So they know that if they're going to use the Cavitron, then that's what they need to use, is to be able to do that procedure for patients.
Oh, that's awesome. So what have you learned now that you're back in and you've been working for several months, a couple of months here? What are some of the biggest things that you've kind of observed or learned that have surprised you about coming back and this whole pandemic?
It's been, we really learned that as bad as things can get, if we put our heads together, we can figure it out and we can come back, and it's not the end of the world, because the media was blowing it up so bad that, like, oh, it was going to be the end of, end of dentistry or end of dental hygiene. And we were like, no, this is a very important part of healthcare, and patients need, we need to continue to provide dental care. And really, it's been 6 months. March 17th, we're almost September 17th. So I was joking. I joke with my patients and I go, this is like, to me, it's like a pregnancy. We've just finished the second trimester. So you have to still find ways to connect and find the humor in it, but also show patients that we're taking this seriously. But we're still humans. We're still, taking care of their needs, our needs, and the community's needs, and also our staff members.
We're in the second trimester. Boy, I'm really curious to see what this baby's going to look like.
Yeah, it's gonna be we're gonna have a big celebration. And it's gonna be, we're gonna give it back. We're gonna put it out for adoption. I'm kidding.
Oh, I notice, or I can feel. I went back and watched our discussion, our 4 or 5 months ago, and now I don't know what it is, but there's you seem happier, or I guess less stressed. Would you say that?
Oh yeah, absolutely. That we were really worried what it was going to look like coming back. And I think it was good to worry. We had to have a certain amount of fear, but we also had to face those fears. And I think I said that last time, and we had to kind of say, okay, we're worried about X, Y, and Z, but this is A, B, C, D, E to Z that we're going to put in place to deal with our X, Y, and Z worries. And I'm really just proud of the whole community, our dental team, our patients. Everybody has done everything we asked and more. They didn't say, oh, we're not going to wear the PPE, or we're not going to screen the patients, or we can't breathe, or we're not going to go to the lunchroom and all not sit together. And they just really stepped up.
That is so cool, and it's so nice. It's so great. There are practices out there, Dr. Areezo, are still struggling. Some still haven't opened yet. Are you seeing any of that in your area?
I had heard that maybe we're a big community of dentists, and I've only heard of one dentist who had not returned to work. But everybody else I know in our community, from our, we work with a lot of different specialists. We have an endodontist practice next door to us. We work with pediatric, ortho, perio, oral surgeons, and everybody that I know in our community has returned back to seeing patients. So, and I think patients appreciate that, because they realize that we are taking a certain amount of risk, but we're taking calculated risks. We're doing everything to mitigate the risk for them and for us and our team members and the community. Oh, I lost your audio. I can't.
There you go.
There you go.
Have you had any experience with patients who are really apprehensive, or patients who are, who don't want to comply with what you're asking them to do?
We've had only maybe a handful of patients who've said, we're not quite ready to come back. But for the, maybe I can count them in one hand for the patients who haven't come back. But they said we are going to come back, but maybe we'll wait till January or spring of next year. And we say to them, we totally understand, you can come back when you are ready at your own pace. but I want to say that 99% of our patients have come back. And once they come back, it's been fine. The one thing that I get a lot is they say to me, we can't hear you, or we can't understand what you're saying, because I have so many, I have the mask, and I have 2 masks, and I have the shield, and sometimes breathing can be hard. So then they turn around to my assistant and they say, do you understand what she's saying? And my assistant says, yes, I do. So she has to translate. So I tell them between my Iranian accent and my masks and everything. But that's been, one of the challenges. Also, I hear from dentists that, and I experience it sometimes too, we get fogged up. It's like, so we have to readjust our mask, or, it's an adjustment for sure. But, it's life. We had to adjust. We have to, it is what it is. And
I don't think it's your accent. I think it's in dentistry. You put a whole bunch of things in a protein, and you say, "So how are you doing?" Really?
Yeah. Well, they don't understand me. I understand them even when they mumble.
So, what advice? There are still clinicians out there. I love the advice that you provided us last time we talked about recognizing that we're here together, that it's important to speak to each other. It's important to communicate. And that resonated very strongly with me. Now that we've been in this now for a couple of months, this is not going to go away, is it?
Right. No.
So what advice would you give, or what kind of what message would you like to give people with regard to the future and kind of thoughts around that?
I think, like you said, this is not going to go away. So when HIV happened, we kind of had to change we had a paradigm shift. Okay, now we treat everybody as if they were HIV and hepatitis B positive. Now we just say, okay, we just assume that all of us have COVID and all the patients have COVID. So, if you take that level and you say, okay, can I treat this patient? What can I, what are the precautions I can take? And then you just then ask yourself and your team members, are you comfortable to do this procedure? And if the answer is yes, you move forward and you do it. And if the answer is no, then you sit back and you go, what else can I do to get to a yes? Or should it be a no? Or should we ask to reschedule the patient? And if it, and I think, again, sharing our concerns with other dentists and the community and saying, okay, you want to come and see how I do it, or saying, oh, this works, do you want to try doing it this way? And helping each other. We are a very good community of, helping each other and getting through it. So I hope in 6 months' time I'm still here and I don't have COVID and my patients don't have COVID, and we can celebrate. We can say, okay, we all got through it, and then hopefully we'll have vaccines, we'll have therapeutics.
So cool, and thank you for that. And you're right. In 6 months' time, this baby will be out. We'll
Yeah.
know what it looks like. We'll know how to deal with it. And I suspect down the road there are going to be other things that we're going to come into. And how do you feel that COVID has prepared us to do that, or do you think it's just made us more crazy?
No, I think it's made us stronger. It's made us realize, okay, we can face whatever is brought. I really believe in the human spirit and the human, I don't know, ingenuity to find out, okay, we are going to deal with whatever problem is going to be presented to us. We are always going to have problems. Life is, ups and downs, and but you get stronger. You deal with one problem, you go, hey, I got it. I can deal with this. And I was reading on some Facebook page, somebody had posted, we've had SARS, we've had the bird flu, we've had HIV, we've had wars and depressions and whatever it is, we got to pick it up, deal with it, pick up, move on, and try to get better. So we will get through this. I know we will. We already have. We're already 6 months into it. We're back 4 months of practice. So.
Oh, that's so cool. So like I did during our last session, I asked you, and now based on what you've learned over the past 4 months, based on what you've experienced, the feedback you've received from your patients, from your colleagues, and then also based on what you personally learned in this, how would you kind of bring that together? And at this point, 4 or 5 months later, what's kind of the sentiment that you'd like to share personally with people who are going to view this, with your colleagues, with your team, with your patients, with your family? What would that be?
That this has been a humbling experience, that you realize that your health and everyone's health is the most important thing. And we just, as long as we stay healthy, we have to be grateful for our health first, and then that we can deal with problems. That I feel a stronger person now than I did before COVID. I really do. I feel like it has given me another tool in my toolbox that has made me. Does that make sense? So we have a COVID tool now. So.
Yeah, what doesn't kill you makes you stronger.
Exactly, and it has. It really has, and I do love my Isolite. So if anybody doesn't have Isolite, you should take the Isolite, or you can come to my office and try that.
Well, I'm glad. I'm thrilled that it worked out for you. If it hadn't, I would have accepted that. That's important to know too. So I appreciate you sharing that. And it sounds like the other things you put in place in your practice have also been very helpful in making sure you, your team, your patients are safe, and that it continues. So that's so great to hear, and I'm so grateful. In 4 or 5 months, would you be willing to join us back again and then see what so that we can talk about what this baby looks like?
I know, we can say, yeah, we gave it up for adoption. We don't have to do it. No, yeah, I would love to. I'm just always find you so kind, and your team, and I'm really grateful for you helping us get the Isolite. It really has made, without COVID, I would have loved to have had it. And it just makes everyday dentistry better and more joyful. And yes, I would love to share. If you guys would have me back, I would have maybe I won't have all my gear back on again, or maybe I will, but I will have some of it back on. Maybe just the pink, and maybe I can back to wearing my high heels and my nice clothes to work. No, I'm kidding.
Well, first of all, I thank you so much for taking. I know you're busy, and you've taken the time during the day. We've probably taken your lunch away from you, so hopefully you can grab a plate.
No
Hey,
problem.
those of you who are watching this, so Dr. Areezo, what is your website, Dr. Areezo?
APAdentistry.com.
APAdentistry.com. And if people wanted to reach out or contact you, what would be the best way to get
Probably
to you?
just call my office 410-268-7100, and I'm always available. I'll call back, and we'll have a chat and maybe a drink.
Well,
a socially distanced drink.
Well, here's the thing. At some point, we will be through this, and I will get to see you. We will get to see each other again in person, and we won't have to give air hugs, and look forward to that day. Thank you for your message. Thank you for sharing everything, for showing how all of your PPE and explaining that, and thank you for joining us. Please, folks, if you like this, share it. If you have questions for Dr. Areezo, please contact her. Check out APA. What is it? Dentistry.
APAdentistry.com.
Yeah, and love the fact that you joined us. Have a wonderful, safe rest of your week, and we're going to talk again. Looking forward to it.
Thank you so much. Be well, and a big air hug.
All right, and I'm really excited to see what this baby looks like. I love that.
I know. We'll get through it. We will get through it.
All right, have a great day. Thank you so much.
Okay, you too, Rolando. Goodbye.
Bye-bye.